Infections of the circulatory system. The circulatory system is made up of blood vessels that carry blood away from towards the heart. Arteries carry blood away from the heart and veins carry blood back to the heart. The circulatory system carries oxygen, nutrients, and hormones to cell and removes waste products like carbon dioxide. Left untreated, toxins produced by bacteria can damage the small blood vessels, causing them to leak fluid into the surrounding tissues. This can affect your heart's ability to pump blood to your organ, which lowers your blood pressure and means blood doesn't reach vital organs such as the brain and liver. Once bacteria have access to the circulatory system, they become widely dispersed bacteremia and are capable of infecting a wide range of tissues and organs. If the bacteria in the circulatory system are not destroyed by the immune system or by antibiotic treatment, they can multiply in the blood and cause septicemia. The circulatory system is acquired through bacterial or viral infection. Intravenous drug use, catheter-associated infections, immunocompromised states, vector-borne infections, contaminated blood products, nosocomial infections, poor hygiene practices.
Now I will be discussing the certain infections and diseases of the circulatory system. First is endocarditis. So endocarditis is the infection of the inner lining of the heart chambers or the endocardium and also the heart valves. So most cases of endocarditis are caused by bacteria like Streptococcus viridans, Staphylococcus aureus, and Enterococcus species. Next is we have myocarditis. So myocarditis is the inflammation of the myocardium or the muscle tissue of the heart. So this is caused by viral infections like enteroviruses, adenoviruses, and human herpes virus. Next is we have pericarditis. Pericarditis is the inflammation of the pericardium, or this is the double-layered thin sac surrounding the heart. So the pericarditis is usually caused by viral infections like the common cold virus. Next is the rheumatic fever. So rheumatic fever usually is has developed from a complication of a streptococcal infection, particularly group A Streptococcus bacteria. Next is we have bacteremia. So bacteremia refers to the presence of bacteria in the bloodstream. So this bacteria usually occurs from existing infections in another part of our body, and then it gains access to the bloodstream directly or through infected tissues. Next is we have septicemia. So septicemia is a presence of growing, multiplying, and developing bacteria in the bloodstream. The most common cause of septicemia is a bacterial infection which can originate from various sources all throughout the body, like urinary tract infection, pneumonia, abdominal infection, or even skin infection. Next is we have the toxic shock syndrome. So the toxic shock syndrome is a toxemia associated with the bacteria Staphylococcus aureus. So some strains of the Staphylococcus aureus produce this super antigen that is called the toxic shock syndrome toxin 1 or the TSST1. Next is we have the puerperal sepsis. So the puerperal sepsis is a type of a nosocomial infection, which means it is acquired in a hospital setting. So this occurs following the childbirth of a pregnant mother and her reproductive system return to its non-pregnant state. So what happens is this Staphylococcus pyogenes infect the uterus, and then further it will spread all throughout the body. Next is we have the gas gangrene. Gas gangrene is when blood flow is interrupted. So the tissues die, and it creates this anaerobic environment where anaerobic bacteria thrive. So what happens is anaerobic bacteria like Clostridium perfringens and the spores, they germinate the ischemic tissue or the dead tissue and colonize them. So they cause rapidly spreading myonecrosis or tissue death. Next is we have the osteomyelitis. So osteomyelitis is when bacteria from nearby infection, like infections from the tissue or open wounds, circulate in your bloodstream and they settle in bones where they multiply. This is commonly caused by the Staphylococcus aureus bacteria.
So next, we have a common bacteria causing infections in the circulatory system. So first, it includes Staphylococcus aureus, a gram-positive bacterium commonly found on the skin and in the nose. It can cause a range of infections, including bacteremia, or bloodstream infections, endocarditis, infections of the heart's inner lining, and septicemia, a severe bloodstream infection. So next, we have Streptococcus species. Several species of Streptococcus can cause infections in the circulatory system, including Streptococcus pneumoniae and group A Streptococcus. So this bacteria can lead to conditions such as sepsis, endocarditis, and cellulitis. Next is Escherichia coli, a gram-negative bacterium commonly found in the intestines. Certain strains of E. coli can cause bloodstream infections, particularly in individuals with compromised immune system or urinary tract infections that spreads to bloodstream. Next is Enterococcus species. Enterococcus are gram-positive bacteria commonly found in the gastrointestinal tract. Enterococcal infections can lead to bacteremia, endocarditis, and urinary tract infection. Next is Pseudomonas aeruginosa, a gram-negative bacterium that can cause infections in various parts of the body, including the bloodstream. Bacteremia often occurs in hospitalized patients, particularly those with compromised immune system or invasive medical devices. Next is Klebsiella pneumoniae, another gram-negative bacterium commonly associated with healthcare-associated infection. Klebsiella can cause bloodstream infections, pneumonia, and urinary tract infection. Next is Acinetobacter baumannii, a gram-negative bacterium known for its ability to survive in hospital environments and can cause healthcare-associated infections. Acinetobacter bloodstream infections are often seen in uh, critical ill patients. So next is Haemophilus influenzae. Despite its name, this bacterium is not a significant cause of influenza. However, it can cause serious infections such as bacteremia, pneumonia, and meningitis, particularly in young children and individuals with compromised immune system. So next is Neisseria meningitis. This gram-negative bacterium is a leading cause of bacterial meningitis, but it can also cause bloodstream infections, particularly in outbreak or among individuals in close contact with carriers. So lastly, we have Clostridium species. While primarily associated with gastrointestinal infections, certain species of Clostridium, such as Clostridium perfringens and Clostridium septicum, can cause gas gangrene and septicemia, especially in the context of traumatic injuries or surgery.
So in this section is we will be discussing for the signs and symptoms that may indicate the presence of an infection in the circulatory system. So the first is we have here the fever. Next is we have the tachycardia or the fast heart rate. During an infection, your heart may beat faster than normal. Next is the hypotension or the low blood pressure. We also have chest pain. Next is the shortness of breath. Next is we also have palpation or the irregular heartbeats. Next is the peripheral edema or also known as the swelling. Infections can cause your body to hold onto an extra fluid, leading to swelling, especially in your legs and feet. This happens because your heart isn't pumping blood as effectively or because of widespread inflammation. Next is we have the skin changes. Let's look at two examples, the petechia and the Janeway lesions. The petechia are small red or purple spots on the skin caused by bleeding underneath. They are often seen in conditions where the blood vessels are damaged or the blood clotting process is disrupted. So we also have here the Janeway lesions. So as you can see from the picture, these are painful red or purple spots that appear on the palm and soles. We also have the neurological symptoms. Patients might show signs of confusion, changes in mental states, or even seizures. Next is the organ dysfunction, and then the blood clotting problems or the altered coagulation parameters. The peripheral cyanosis, then the murmurs. Doctors may hear an abnormal sounds called murmurs during a physical exams. We'll discuss the treatments available for the circulatory and cardiovascular infections. The treatment approach depends on the type and severity of the infection and typically involves a combination of medication, lifestyle changes, and sometimes surgery. So first is we have here the antibiotics. Next is we have the antifungal or the antiviral medications. The anti-inflammatory drugs. The anticoagulants or blood thinners. We will have here additional treatment options for our circulatory infections. We have here the surgery, lifestyle changes, and follow-up care. So it is important to remember that treatment plans are tailored to each individual. So always consult a healthcare professional for personalized advice.